Okay. Hi, everyone. My name is Gabby James, and today I'm going to present my research proposal to you. I first wanted to thank everyone for taking the time to come listen to me today. The main research question I want to present to you through this proposal is to determine if ethnicity affects COVID-19 mutations, as well as gender and age. Today, I'm going to go over a brief overview of COVID-19. I'm going to talk about any previous research and then my hypothesis. I'm going to talk about some objectives and specific aims, and then my methods and my materials needed to do the research. By the end of this presentation, I want to show you that we do need to know the significance of COVID-19 mutations and the factors that affect them. So just a brief little overview on COVID-19. As we all know, COVID-19 is a super hot topic right now. You can't go anywhere or do anything without hearing about it. So COVID-19, it is a positive sense single-stranded enveloped RNA virus with a helical capsid. Coronavirus is actually named because of its spike-like receptors that actually resemble a crown. The coronavirus is grouped into 4 groups: the alpha coronavirus, beta coronavirus, gamma coronavirus, and delta coronavirus. The gamma coronavirus and delta coronavirus are only able to infect birds. The alpha coronavirus and beta coronavirus can infect birds, mammals, and humans. The coronavirus causes respiratory tract infections. It can cause mild symptoms, such as symptoms you would get from the common cold. And it's affected over 29 million people since it started. We're going to talk a little bit about the genome size, since this is kind of where the research is going to be coming from. So the coronavirus has one of the largest genomes for an RNA virus, which is 27 to 32 kilobases long. And the coronavirus has codes for 22 to 29 different proteins. So the genome size can be anywhere from 27,317 to 31,357, again, making this the largest genome for an RNA virus. So we're going to kind of go into depth of where it all started and how it started. We're still a little unaware of how it started, but the first official case for COVID-19 was on November 17th, 2019 in Wuhan, China. On December 31st, 2019, the Wuhan Municipal Health Commission stated that there was a significant amount of reports of a viral pneumonia in Wuhan. Of course, this viral pneumonia was COVID-19, but we didn't know at the time. So on January 9th, 2020, Wuhan announced that this string of the viral pneumonia was due to coronavirus. And then on January 11th, we had the first death from coronavirus. And then on January 21st, 2020, the first case was confirmed in the United States. As you can see, that's like a 2-month window where we got the first official case in China, and now we got a first one in the United States, and we are realizing that COVID-19 is a bigger deal than we thought it was going to be. So there are 3 types of testing for COVID-19. And so because COVID-19 has similar symptoms to the common cold and influenza, we are required to use these 3 types of laboratory testing to identify if a patient does in fact have COVID-19 or if they do just have the common cold or influenza. So COVID-19 can be identified using the 3 types of tests: the antibody test, the polymerase chain reaction PCR test, and an antigen test. An antibody test is a test that looks for the presence of antibodies that are produced by the immune system to fight off COVID-19. The PCR test, which takes a few days to get the results back, looks for the genetic material of COVID-19. And then the antigen test detects the presence of viral antigens and parts of the viral spike protein. So COVID-19 today, as we know, there are still many unknowns about COVID-19, but we also have a lot more knowledge about the COVID-19 virus, and it's becoming more readily available. We now have a vaccine that has been administered to over 100 million Americans just alone. And of course, and now anyone who's 16 and older can get the COVID vaccine. So does this mean we're at the end? Well, that's what we're doing this research for, to see if the coronavirus will mutate and these vaccines will not work, or if everyone can just get vaccinated and we can move on and not have to worry about COVID-19 anymore. But worldwide so far, and these numbers are a little bit old, so there may be more. Worldwide, 118,567,089 people have tested positive for COVID-19, and 2,629,710 deaths worldwide have occurred because of COVID-19. In the United States alone, 28,846,746 people have tested positive for COVID-19, and 541,621 deaths have occurred. So I am planning on seeing if ethnicity has an effect on the mutation rate of COVID-19. I will look at 4 different ethnicities: white, Black, Asian, and Latino. I will also look to see if gender or age have an effect on the mutation rate of COVID-19. So for previous research, there's no previous research on ethnicity, gender, age affecting the COVID-19 mutation rate, but there is research on the death rates and infection rates for the different ethnicities, genders, and ages. What is determined from that is that more males die from COVID-19 than females, as well as the older you get, the higher chance you are of dying from COVID, which we all kind of knew that. For ethnicity, they are not really seeing much of a difference. African Americans and Latinos have a little bit higher of a chance of dying from COVID-19, but it's not significant enough to make an assumption. My hypothesis. So I hypothesize that ethnicity will not have an effect on the mutation rate of COVID-19, but gender and age will both have an effect on the mutation rate of COVID-19. I feel the older groups will have a larger mutation rate than the younger. My aims. So my aims are to determine if ethnicity can affect the mutation rate of COVID-19, to determine if gender can affect the mutation rate of COVID-19, and to determine if age can affect the mutation rate of COVID-19. These aims will be determined by taking patients that have tested positive for COVID-19. I will not inject COVID-19, a deadly virus, into people, healthy people. So I will take patients that have tested positive and place them in groups on ethnicity. So I will use white, African American, Hispanic, and Asian. I will use both men and women, and I will use the age range of 20 to 90. I will break them up initially into just the race to see if the ethnicity does indeed affect the mutation rate. After that, I will then look at the gender to see if the gender is affecting the mutation rate of COVID-19. I will then group them based off of their age, and I will do as follows: 20 to 30, 30 to 40, 40 to 50, 50 to 60, 60 to 70, 70 to 80, and 80 to 90. Again, stopping at anyone above 90. So, disclaimer, since I am using humans as the subject for this research, a signed written consent will be attained from each individual in the study. I will not be using children or adolescents in this study, so there is no need for parental consent. So the experimental design. So I will be following after mutations on COVID-19 diagnostic targets by Wang et al. So we will take patients who have tested positive for COVID-19 and divide them into groups based off of their ethnicity, age, and gender. The COVID-19 genome will then be extracted from each patient in the different groups. The full viral genome will then be placed into a GISAID database for later use. Once the full genome is obtained, we're going to use cluster omega multiple sequence alignment, and we're going to take the proteins and generate them from the viral genome. The SNPs are then going to be recorded and compared to the original COVID-19 genome. The changes in the genome will be between the different ethnicities and then based off of the original COVID-19 genome. So we will use the same genome for both ethnicity, for age, and for gender. And then to accurately, make sure this data is accurate, we will take the viral genome and it will extract it the day that the patient tests positive for COVID-19. 1 week later, we will also extract the genome again, and we will compare those two genomes to the original as well. So for my results, I do anticipate that ethnicity will not play a very significant role in the mutation rate of COVID-19. I do anticipate that gender and age will play the largest role in the mutation rate of COVID-19.